the heart of Nigeria's northwest region lies Sokoto State, a land rich in tradition, culture, and vibrant communities.
The TCI has been a partner with a difference, because before the coming of TCI, yes, we have other interventions in the area of family planning, demand generation, service provision, but it is not that strong. But when the TCI came, they focused specifically on demand generation, creating awareness so that community members, people who need to know, they become aware of this family planning services and the availability of multiple commodities that they can use. And then they also go out of their way to triangulate and showcase to these community members the religious and the traditional implication to the use of family planning commodities and services. So before, many people were not aware of the benefit and the services of the family planning commodities, but with the coming of TCI, more awareness has been created among the populace, and they are now no more hesitant. They are no more doubtful about the family planning commodities and services.
The coming of TCI, we have recorded a lot of changes when it comes to the issue of family planning, because when they come at the time when the family planning in the state, the performance was very poor. But when they come for their intervention in the area of demand generation, that's campaigning for people, awareness of the people to know how important is the family planning. Also, they support us in the area of building the capacity of our staff, both at the state, at the local government, and at the facility level, so that they can be able to provide quality service for the people that require these family planning services. You understand? So actually, also they supported us in the area of data management, because whatever services you provide at the facility, the decision we are taking is a data driven. It's based on the data that we know where we are and where we are, what we have reached, especially when it comes to family planning. I know before they come, the service, the contraceptive prevalence rate in Sokoto was around 2%, but at this time that we are talking about, it's getting to 8%. So without recording the data from where we said, what are the data at that time when they come, and then what is the data, we cannot identify this progress that we have recorded in the state. So actually they have contributed a lot. They supported us in this area, which definitely actually has contributed a lot in the area of family planning in the state.
TCI program in Sokoto is a job well done, and it's one of the different programs we have been having, because since 2010 I was trained as a family planning provider, and I have been working with so many organizations in family planning. But TCI came in with something different this time in their training, which in their training it has been integrated. But the family planning, the GVV, the adolescent, as well as people with disability, they are all being included, as well as the community. It is in only TCI we have seen the mobilizers will go into the community, they will mobilize clients, and they will offer them a card which they will take to the facility for the offering of the family planning services, which is that for the TCI. And it's only in the TCI that we have seen they have done the family plan and also chip in adolescent reproductive health, including the family planning also for the adolescent, which all other organization has not been doing that. Also in the mentoring and supervision that we are taking for the TCI, it includes mentoring not just for the family planning. They mentor the family planning itself, how the commodities are. They also mentor the corners for the adolescents, which they integrate in it, and also they mentor about the people with disability once we go for the mentoring and supervision.
Zuwan TCI a Sokoto sun taimaka mana sosai, domin suna aiki tare da ma'aikatanmu a cikin gida da kuma waje. Abin nufi a nan shine zuwan mutanenmu a asibiti domin karɓar abubuwa na tazarar haihuwa. Waɗannan matan da suka koyar da suke zuwa gida-gida suna ma mata bayani, akan tara su ne nan cikin asibiti tare da malaman lafiya domin ba su abubuwan da suke bukata na hutun tazarar haihuwa.
To kahin zuwan TCI gaskiya mutanen da a gare mu suna kaɗan saboda babu faɗakarwa, babu wayar da kai dangane da harkar tazarar iyali, sai dai abin da mun kai nan cikin asibiti. Amma kuma da TCI ta shigo wanda yake ta zaɓi mobilizers waɗanda mata da maza waɗanda za su rika shiga cikin gidaje ana faɗakar da mata dangane da harkar tazarar iyali. So suna shiga suna wayar da kai kuma ana tahowa asibiti, duk wanda an ka ba wannan katin na zuwa asibiti zai taho asibiti kuma zai samu services din. To kaga wani yana ƙara taya faɗa ma wani.
Surely, Sokoto State people have been enjoy and welcome to CI for the kind of intervention they give to the Sokoto State in terms of family planning. So family planning now has been accepted in Sokoto State for more than we have for all about 48. More than 48,000 people that receive family planning in Sokoto State, and still people are still seeking for the family planning is due to the kind of association mobilization awareness we are having in Sokoto State. In terms of a lot of intervention we are having in Sokoto State by doing neighborhood campaign, which we are doing in health facility. We are mobilizing people in health facility, and we are doing BM, which is voluntary mobilization, which our mobilizers used to go to house and mobilizing people to let them know what is the importance of family planning or child birth first.
Muna nan muna faɗakar da mutane bisa ga waɗanda abubuwa sosai. Nan ni nan nake shayi bakin asibiti, kuma gaskiya alhamdulillah yadda mutane ga tahowa suna zama irin wurin ganawa, ina tunatar da su akan wagga tazarar haihuwa, mun zanna ana ɗayan masu bayanai haka don su ɗan kula, ko da akwai mai buƙata ya shi man bayani sai ni kuma sai in zo in yi bayani.
Gaskiya lokacin da nika yi nutsa ƙwarin jiki babu shi, saboda dai ban yaya wanga ba kuma na ɗauki ciki, ga rashin kuzarin jiki, ga rashin ƙarfin jiki, sai na bi na rami kamar wadda adda ciwon yunwa. Gwargwado dai kuma mai gidana dai gwargwado yana yi min lalurar abinci, ba ni da yunwa, amma saboda wannan rutsar ita ta kasa ni wannan rama ga lalurar iya. Wallahi da na gama yanzu haka, don yanzu haka shekara ta kusan 4 da haihuwa, da yake aiki an kai ni, inda ban yi tazarar nan ba da ina ganin ban ma kai shekara zan ɗaukar wani ciki.
The significance of TCI here is not overemphasized. They have done well. They have invested huge resources. They mobilize community. They change the perception of community members. They also use the media outlet every day in, day out, delivering messages to audience so that to change their perception, change their thinking. And today we have greater percentage of population accepting family plan as a result of their intervention in Sokoto State.
Yeah, this challenge initiative is important, that every day we learn. We are not just product of what we have, where we have been, but we also take cognizance of where we are today in order to plan for tomorrow and make it better. So this challenge initiative is a very, very important one. Challenges us to rise up to what is the current practice, and not just the best current practice that can be applied in building and raising and sustaining healthy families.
TCI started, I think, by engaging DevCons, which in turn recruited some journalists, trained them on how to report issues surrounding family planning, especially in Sokoto State. These journalists have not only been trained, but they have become advocates of change as far as family planning in Sokoto is concerned. They visited several facilities. They've interviewed several families, and they've written, as a result, they've written some very important pieces of information, pieces of news stories that have sought to educate the people of Sokoto State generally.
TCI actually, they have really tried, and apart from that, they trained us as the World Development Committee members. They gave us training, they invited us and acquainted our members with modern method of family planning, in which we also went back and conveyed the training known as step-down training to other members of World Development Committee. So actually ours is that we try as much as we can to make sure that there is an uptake of family planning in Sokoto State.
With the coming of this TCI in Sokoto State, the people of Sokoto State has benefited a lot in terms of awareness, in terms of availability of the commodities, creation of demand generation. With the coming of the TCI in Sokoto State, we try to go to pay an advocacy visit through my office to see Her Excellency, the wife of the Sokoto State Governor, which we are able to see her, and we even crown her as a family planning champion. And with that, we are able to get the approval of over almost 30 million naira into the account of family planning, which is the first in the history of Sokoto State. And she has even promised she will do even more because of the importance that it has in the people of Sokoto State.